If you know your own body, I just knew something was wrong. I had several symptoms. I went to the neurosurgeon, they did the CAT scan, and immediately he called me back and said he saw a dark spot in my neck.
Sherry was stunned when her local doctor diagnosed her with a cancer of the cricoid cartilage in her larynx, also known as the voice box. This cartilage provides the structure to keep the airway open. Removing it would mean Sherry would be unable to breathe through her mouth and nose, breathing instead through a hole in her neck, and would no longer be able to speak in a normal voice.
Cancers of the larynx are relatively uncommon, but when they do occur, it is clearly a very concerning situation for the patient. There's a variety of different treatments available that attempt to preserve laryngeal function. The one thing that's been a constant challenge with laryngeal cancer is the question of how can we remove part of the cricoid cartilage and rebuild it? And that's been something that to date has been difficult to solve.
Dr. Chapea proposed a unique option to Sherry, removal of the cancerous tumor in her larynx without a total laryngectomy. This would necessitate rebuilding her cricoid, the structural scaffolding of her airway.
So I think I'm probably looking at him kind of freaked. You want to try something on me? It's never been done before. But then again, I thought, what other options do I have? I have a laryngectomy where I'm not going to have the voice, maybe not go back to work at all.
Knowing that a total laryngectomy could still be an option if needed, Dr. Chapea and his surgical team performed a transplant of the cartilage and muscle with their attached blood vessels from Sherry's own shoulder blade to create a curved cartilage to replace her cancerous cricoid, actually rebuilding the structure of the larynx, then reattaching the delicate muscles and connecting her windpipe.
It looks like it was scheduled to produce in October.
3 months later, Sherry was fully recovered, back to work, and in good voice.
As far as I know, I'm cancer-free. I get the CAT scans every so often, which to make sure that nothing has came back, but I feel great.
This procedure has never been done before, to my knowledge. This opens up a lot of new avenues to apply this type of technique in a variety of different diseases.
I do feel like it was a miracle just for the fact that I knew there was something else that could be done. And I happened to fall into the right place with the right surgeon at the right time who was willing to try something that never had been done.